Hi, welcome to Snackable Health with Kohli and Gibson, and we're talking about the week's announcement that the BA.4 and BA.5 variants now have a booster directed at them from Moderna and Pfizer. Talk to us a little bit about that news, Pal.
Mike, this has been a long time coming, and I'm so excited that it's finally here. These are the bivalent boosters. So not only do they have that original Wuhan strain, but they also have the BA.4 and the BA.5, which is our subvariants of Omicron. And, I think it's hopefully going to help not just boost how many antibodies we have, but also the types of antibodies, because now we've got a parent strain, which is the Wuhan strain, and we've got a specific one. So hopefully it'll do a better job of protecting us against infection and perhaps even have that antibody response last longer than what we saw for the last set of boosters. And I like to kid around that our original booster was a Toyota booster. It was reliable, it did its job. But this now is a Tesla booster. It's an upgraded booster that hopefully will do that job even better.
It is a Tesla booster that's been tested on animals, not as much human data. I think there's a little bit of pushback to that. How are you going to vote with your syringe? I know I'm going to get the booster. Are you going to, Pyle?
100%, Mike. I have no doubt in my mind. So the FDA actually told them they didn't need to have human data because of a couple of reasons. So when it comes to vaccines, we think about two things: how safe are they and how well do they work? And with respect to safety, I mean, this science is well established of swapping out one strain, so to speak, and putting in a different one. We do it every year with the flu vaccine, and we've done it, for decades. So I'm not so worried about the safety or that it's going to be a different safety response to this. And in animal studies, there were no safety signals. There was also safety data from a BA.1 booster that was tested earlier this year by the vaccine companies in humans. So I think I feel good about that. My bigger question is, how well does it work? The animal data, Mike, is telling us that it works quite well. In fact, in mice, it can protect you from Omicron infection 20-fold more than the original Toyota booster did. So I feel pretty good about the fact that I'm ready to put my arm out and get that extra layer of protection, knowing that several months have gone by since I've gotten my last dose.
I asked Paul Burton, the CMO of Moderna, how quick can you guys turn these vaccines around now? And he said, from when we detect a variant to getting a variant-specific booster developed is going to be about 30 days. So
Wow.
if they can turn things around that quickly, do some safety testing in animals, I'm hoping we can get on top of some of these new variants. It's an amazingly rapidly evolving field. Well, thanks, Pyle. Thanks for joining us. And thanks to all of you for joining us here with Snackable Health.